Thank you. Next up, I'm going to invite Andrea Liddell from West Cancer Center. She's going to present on financial toxicity in cancer care as barriers to access.
Good evening. Thank you for having me this evening to come and speak on financial toxicity in cancer care as barriers to access. So we know that some of the financial barriers are in a 2017 ASCO National Cancer Opinion Survey. It was identified that 2/3 of cancer patients expressed an interest in communication with their provider regarding treatment cost, but only 27% of respondents reported having those costs discussed with them, related discussions. So we have to ask ourselves, let me advance to the next slide. So we have to ask ourselves, when is the last time you made a high dollar purchase and did not know the cost? Cancer patients do this every day. 74% of patients report an upfront cost estimate would definitely impact their view of their health care. What are the facts? Study 607, women with history of breast cancer. 78% of women surveyed preferred to understand costs prior to starting treatment. 78% of them never discussed costs with their care teams. 2/3 of cancer patients expressed an interest in communicating with their provider office about treatment cost. And out of that 2/3, only 27% reported having these discussions. According to the Becker Hospital Review, engaging patients early and accessing their propensity to pay are considered best practices for medical offices and hospitals. So what's impacting patients' financial burdens? Innovative treatments equal extended life. High cost of new treatments, increased access to care, patients taking drugs longer, higher patient responsibility, employment changes, financial, insurance risk, all this equal the perfect storm. And I have a story regarding the perfect storm as it relates to the changes, the financial and the insurance risk. Both of my parents had lung cancer. Both of my parents lost their battle to lung cancer. My mother had just retired and ended up with a lung cancer diagnosis. So when patients come in, I can definitely understand, and I have that passionate for our patients, that you retire, you have your life savings, you save money to put your kids through school, vacations, to buy the boat, and then you get this lung cancer diagnosis. So what are you doing? You're paying everything that you've saved for your life. You're paying to try to live longer. The same thing with my father. 6 years after my mother passed, my father was also diagnosed with lung cancer. Both were smokers. And it was the same thing. I understood. He was on traditional Medicare. We did the Advantage Medicare plan. But once again, to have cancer treatments is very, very expensive. So we have the comprehensive financial advocacy program at West, which is best practices. And what we do is we provide an explanation of individual insurance coverage and benefits to every patient. We screen our patients for coverage. We use a third-party outside source, which is First Source, and they screen all of our patients. Patients that are uninsured, they screen them for Medicaid and Medicare if they're Medicare eligible. If they have Medicare traditional, they screen them for Medicaid as a secondary to help with that 20% cost. They also discuss marketplace plans with patients that are uninsured. We have an on-site screening, which is our patient assistance, and they screen our patients for different drugs, for drug replacement, which is free drugs from manufacturers. They also screen patients for copay assistance, which help with commercial plans to help with those copays to offset that cost. We also have grants and foundations, and our patient assistants search for those through the fund finders, and those are based on diagnosis specific to certain diagnosis. We also have the Practice Financial Relief Program, and that's our West Cancer Foundation, which help women with mammograms so they can be able to get their screenings each year. We provide an estimate of patient responsibility to give the patient their care plan from day 1 to cycle 27, and if anything should change in between that, we go back and we provide a new estimate. We evaluate the propensity to pay of each patient. We have close conversations with these patients. All of our advocates are in the clinic. They meet with our patients, and they have these conversations to see if they're able to pay and if they have any type of financial concerns. We do set up flexible payment arrangements for patients that would like to pay, but they're not able to pay up front. They need time to pay, so we do payment arrangements. And most of all, we have ongoing support for changes in patient situations or in their care plan. So the purpose of our financial advocates is to assist patients in all financial-related areas, including insurance billing, insurance coverage, payment responsibility, and overall financial coordination. Our mission is to provide and to ensure a good financial experience for all of our patients. We are committed and we're dedicated to providing consistency, clarity, and overall transparency to all of our patients. Financial hardship. It is the most common on the economic spectrum among populations, and it relates to cancer care. Financial advocates want to alleviate the financial burdens. So the overall objectives is insurance enrollment, if available. If not, if they're self-pay, we still have other programs that can help our self-pay patients. Maximize utilization of patient assistance. Patients' understanding of financial responsibility. Patients' understanding of a financial assistance provided that offsets their costs. We use a 5A approach by asking, assessing, advising, assisting, and then arranging. Upfront collections or flexible payment arrangements, all to enhance the patient's experience. Are there any questions? Thank you.